to our top story of the day right now, which is Fotis Dulos' attempted suicide yesterday. And this morning, we're trying to learn more about the type of treatment he could be getting at Jacobi Medical Center in the Bronx.
So Dr. Stephen Wolf is joining us now to break down all of the medical questions that a lot of people have. We have as well. Dr. Wolf, thanks so much for being with us.
Thank you. Yes.
First off, tell us a little bit more about the specific hyperbaric chamber at this facility that Dulos was taken to, and so why New York? Why this location?
Well, I have no direct knowledge of their particular chamber, but usually in a situation like this where a patient is in critical condition, you need a large multi-chamber, multi-size patient chamber, and it's like the size of this studio, where you can put personnel in there to keep to monitor the patient. So most likely a patient that needs that kind of chamber is on a respirator and has all kinds of other machines attached to them. So it's not a small operation. So you need a large chamber.
So the pictures that we've been seeing that looks like you could just slide the person in, that is not what would be happening there.
No, those are single chambers, usually used for wound management. Can also be used for other things as well, for dive accidents. But this is a little bit different because the patient is unstable, most likely, and so you need to have multiple people in the chamber with the patient.
Now, and this is just to get the carbon monoxide out of the system, I assume?
Well, the carbon monoxide, when you're using hyperbarics, within 30 to 60 minutes is already half the level that it started at. So we don't know where the level started. You usually by the time you transfer a patient to a chamber, the CO level is already much lower because you're already giving the patient 100% oxygen.
Right.
You give a patient 100% oxygen, it takes an hour to 2 hours to drop it to half the level. So it's not so much the initial treatment, it's the theoretical advantage of treating the sequelae and the later results to neurological damage.
Okay, I guess, yeah, that was getting to my question. Is this more of, for lack of a better word, trying to just remove the toxin, or is this trying to heal any damage that may have happened?
The literature is all over. It's not a completely agreed upon process, and there's a lot that's not known. But the hyperbarics do seem to reduce the later effects of neurological damage. It is not by means a miracle cure.
Right.
It is similar. The damage can be similar to somebody who's been in a cardiac arrest, hasn't had oxygen for a long time, and you don't know what the condition of the brain is for possibly a long time. So it helps prevent some of the damage, but it doesn't, it's not a miracle cure by any means.
Yeah, we don't want to speculate because we don't know how long the carbon monoxide exposure went for. So, but how great is the benefit?
Of the hyperbarics?
For a situation, as far as what maybe you've seen in your experience?
It's very difficult to say. Really, the critical aspects to this is how long any patient has been without oxygen. We have no idea how long in this case that occurred, and so there was apparently CPR being done. So that already is a concern, and so it's the same like a cardiac arrest. You just don't know once you've resuscitated the patient and they're in the intensive care unit. They may be in a coma, and you just don't know how long it's going to take. In this case, hyperbarics is a part of the treatment, but it may not have any beneficial effect at all.
The treatment, would that be a normal step for anyone who has gone into cardiac arrest?
No, this is just for the carbon monoxide or other sort of dive accidents, things like that.
And knowing that CPR was performed, I guess to me that means that either he had stopped breathing or his heart had stopped, one of the two. Is that a safe assumption, or is there other reasons to perform CPR if somebody's heart is beating and they're breathing?
Normally, and I don't want to speculate on this, but normally you don't do CPR unless the heart has stopped. You may have to intubate the patient, and the patient could still not be breathing, but have a pulse, and so you would intubate and put the breathing tube down into the lung, but not do CPR necessarily.
And how long does the treatment last? How long would they be treating him?
Usually it's several treatments within a few days. Again, they usually last several hours because you also have to get to atmosphere. You have to pressurize the tank, and then you have to slowly decompress. So it's just like diving. You can't just go down and go up. So it's a long process, and then it's different centers use different protocols. So it's going to be, but usually it's multiple treatments within the first 1 to 2 days.
Of course, we still have a lot of questions. Dr. Stephen Wolf from St. Francis, thank you so much for joining us. And my understanding is you'll be able to join us again in the 8 o'clock hour.
I can.
Okay, yeah, we can talk a little bit more about where we can go from